Is this you? Have you ever worried what would happen if you got sick or injured? Would you be able to receive quality health care or even a place to be seen? Do you worry about the barriers that you might face to receive this care? Like transportation, money, health insurance, being able to see a doctor versus putting food on the table. Do you envision healthcare to look like this or like this? For the next few minutes, we are going to explore the issues of access to healthcare and what we can do to make a difference. First, our healthcare system is ranked 37th when it comes to quality of healthcare systems of industrialized countries. We are only above Slovenia. We spend far more of our money on healthcare than any other country. Healthcare is complicated, but there are things we can do to understand it and to make it better. According to the National Association of Social Workers Healthcare Policy Paper, access to quality healthcare is vital for us to meet the goals set out by Healthy People 2010 and again in 2020 to increase the quality and years of healthy life and to eliminate health disparities in the U.S. population. Our goal as social workers is to eliminate the health inequities that are abundant in our society. Healthcare is a right. Minorities and poor populations are disproportionately uninsured. This lack of coverage makes those obstacles even more insurmountable for these populations. Social workers are working diligently every day to ensure that these vulnerable populations have access to care by navigating these barriers, educating their clients, and advocating for more universal care while addressing the social determinants of health. These include person's socioeconomic status, neighborhood, employment conditions, ethnicity, and personal behaviors. Most other industrialized countries have some form of universal health care, and their health indicators are much more favorable than the United States. Also, the amount of money they spend on their health insurance is much less than in the U.S. Each one of these systems is a little bit different, but does provide access and care to the vast majority of its citizens. I would propose that we work on France's universal system that is ranked number one by the World Health Organization. I would take a look at universal health care and make a few tweaks to be able to provide the most access to quality health care and coverage to all of our citizens. The main tweak that I would make would advocate for taking away insurance lobbyists away from our elected officials so they could make their own decisions. Critics of universal health care say that it would not work here because their health care costs are rising everywhere, that they do not really provide access insurance to all, and the last piece is that it takes away from the free market system. To counteract this, all market healthcare dollars are increasing, but none as fast as the United States healthcare money. The other universal healthcare system covers 95% or more of their population, and the U.S. only covers less than 85% of its population. And as far as free markets go, that's how our whole healthcare system got into this mess in the first place, as insurance companies sets rates for reimbursement. As you can see by the search done on this one procedure, you can see it can vary drastically in price depending on where you go and which provider that you see. So how can we move forward to be able to provide access and coverage for all? This is a great question. It starts here, it starts today, and it starts with you. There are three simple things that you can do. You have already started on step one, which is becoming educated, having knowledge and awareness, and acknowledging this issue is the first step into taking action. I encourage each and every one of you to learn more about this issue and join the fight. The second step is to volunteer. We have seen throughout the course many great organizations here that you can donate some of your time, and there are many more. Your time and effort is so invaluable to these organizations because it allows them to serve their populations and meet their needs. The last step is a two-part process. If you have not already registered to vote, please do so. Once you have done this, please contact your representative so that your voice may be heard to advocate and ask for universal health care for all of our citizens. If you are not a registered voter, they will not listen to you, so please make your voice be heard. Thank you for your time today. Let's together move our society and country towards equitable greatness.
I love you, America.